In this episode of Ask the Doc, I got a great question from somebody on YouTube that's dealing with a herniated disc in their cervical spine and is considering having surgery. What's up, everybody? Dr. Matt Maggio here, creator of the 𝐾 method and founder of the Soft Tissue Revolution, where we are on a hell of a mission to make chronic injuries obsolete by helping those that are injured and in pain get properly educated and informed on their injuries and access to quality hands-on soft tissue treatment so they can avoid bigger problems down the road like pain pills, injections, and surgeries that only make things worse. Great question on YouTube. I'm going to read it. Someone that was dealing with a herniated disc in their neck. It's kind of a long question. I'll link it up in the description below as well. I have been dealing with chronic neck pain for the past year and finally was able to get in for an MRI that confirmed degenerative disc disease and herniation at C5, C6. That's in your neck. When I got that diagnosis, my jaw hit the floor because I'm only 34 and I thought this only happened when you get older. I have scheduled a few appointments with some orthopedic doctors, but it will still be 2 months before they get in, and I'm fearful that I will need surgery, which scares the hell out of me. I have been researching other non-surgical ways to fix a disc problem, but it all seems hocus pocus to me. Is there a way to heal this disc injury without surgery, or do I just need to bite the bullet and have it done? Sending that question in, and yeah, sorry to hear you're dealing with that. It sucks. I'm 37 years old and I first got my MRIs confirming multiple disc injuries in my neck and my back when I was 26. It was even worse when the radiologist called me because I knew him and he said, "Hey Matt, how many car accidents have you been in?" I was like, I've actually been in just one, and a very minor one. He goes, "Well, your spine looks like you've been in about 20. Well, I did play football. I played football in college and bashed my head into other humans, and yeah, it sucks when you see that. And you see it and it's your MRI and it's so jacked up and you're like, how did this happen? Like, this is something that's supposed to happen when you get older, and disc injuries can really scare you, and they give it that fancy name, degenerative disc disease. It sounds really scary, and it should be. It is a big deal because the problem with degeneration is it will get progressively worse. And if you're only 34 with it, thinking about that future is a big concern for you. And I'm honestly glad. I got scared too when it first happened. You know, I was fresh in practice. I knew enough about what was going on, and I knew that it wasn't just the discs themselves. There was other components involved. You know, the neck not moving how it should, the muscles, the ligaments, the tendons, all that stuff around there. And the disc ended up being more of the effect, and other things were the cause. I thought about injections. I considered a surgery, but I'm glad I didn't, because at the end of the day, there are things you can do to heal up this disc injury without having to jump to surgery. I know it's scary, but there are things that you can do, and I'm really glad I didn't do that. So what I wanted to link up this week was an older video I made that got a lot of traction a couple of years ago, but the message is still the same, where I really dive into how you can actually heal a disc injury without surgery and it can get better. So I want to link that video up first. In today's video, I want to talk about disc injuries, specifically disc bulges, disc herniations, and even disc extrusions. So disc injuries are becoming more and more rampant and more common in our society. We spend a lot of time on devices, sitting, not moving how we should. And over time, what happens is it really beats up our muscles and causes big problems. I talk about this all the time, the idea of what's called scar tissue. Scar tissue is like glue that gets inside the muscle, makes it very hard for the muscle to stretch and contract how it's supposed to. Think of it as like plaque in your teeth, but that builds up over time in your muscles. Then what happens is these muscles can't support your joint. So if you think of your disc is in between the bones in your spine, and it's a very good shock absorber. It's very good at handling force like this all day long. Over time, what happens when that scar tissue gets in there, it puts more pressure down on that disc. So now what happens, instead of your disc going like this, it starts to slide and grind on itself. Before you know it, now you got all this pain, and you end up at the orthopedic doctor, maybe the chiropractor, even your primary care doctor, and they send you out for an MRI, but this has been building up over time. The disc doesn't just blow out overnight. It's from repetitive overuse and trauma. Now, when someone does get diagnosed with a disc problem, specifically degenerative disc disease, it can be scary. And it should be, because it is a really big deal. But so many people end up at the orthopedic surgeon's office first before they actually get a conservative method to fix it. So think of your disc as like your thumb, and it's stuck inside a car door. The car door is all that scar tissue. You cannot give your disc a chance to heal until you remove that scar tissue. And what happens is people panic and they freak out because they're in a lot of pain. They end up in the surgeon's office, and there's new codes out there called failed back surgery, failed neck surgery, because they tried to fix the disc first, but they never actually fixed that scar tissue. So how to get the disc to heal without surgery or injections? So the practitioners that are trained in the 𝐶 method, they are experts at finding and fixing scar tissue. What they're able to do is get in there very precise and very focused with their hands and the use of an instrument. And over a series of visits, they get rid of all that scar tissue. As we do that, the muscles become healthier, stronger, and more flexible. And what they do is actually start to decompress that disc and take the pressure off. It goes right back to what we talked about, to the car door and the thumb analogy. And if you remove that scar tissue, you're going to give this a chance to heal up. Regardless, even if you think you need surgery, you need to get the scar tissue figured out first and get that fixed by a trained practitioner. And the best part is you can get access to them by clicking the link below. That will take you over to our website, and you can find out more about the 𝐶 method and see if there's a practitioner in an area that can help. If you enjoyed that video, it was in my younger days, but just to kind of recap a lot of the issues in the video from what you see. Number one is the idea of like the cause versus the effect fallacy. So much of medicine, especially musculoskeletal care, focuses on the effect. The disc is actually blown up because of other things not moving. So if they go in there and they start to fix the disc, but they never got what actually happened, that's why you're having problems. This is why people are getting more and more surgeries, and there's those failed surgical type of diagnoses. Number two is there's just risks involved with surgery. You know, the surgeons make it out, oh yeah, we'll just go in there nice and easy, snip, snip, in and out, you'll be good to go. They literally go through the front part of your neck and they move your voice box and your esophagus and your trachea out of the way. You're under anesthesia. You could get an infection. You might not wake up. There are real risks for that, and some of the complications are death, and people don't consider that, and the surgeons don't consider that as well. They just make it like you're going to go in and out and it's going to be good to go. Number three, there is a time component to an injury, and a lot of times when people first get injured, they blow out that disc, it hurts like hell, it's so much pain, they will do anything to get out of that pain, and then they end up early in the process in the orthopedics office, and they're like, yeah, we'll just get you scheduled for surgery, go in there. But here's the thing, time starts to heal things and things start to get better, but you have to leave it alone and let the body do its thing, getting it better without jumping into that surgery. Number four, just get multiple opinions. So many people just go to one place. Imagine if your car blew up, or not blew up, but had a problem, and it was you go to one mechanic and they're gonna say, oh, it's gonna cost $5,000, it's gonna take a month to do that. You'd probably go get multiple opinions. So many people, when it comes to your body, your neck, your spine, they get one opinion. Get multiple opinions, see lots of different people and figure out what exactly is going on, make the best decision and use that time component. Don't jump in. Yeah, it's gonna suck in the short term. It does suck. You are gonna be in pain. It's going to suck, but your body can start to heal it up and you can do things better like we talked about in the video. So in closing, sorry you're dealing with this, it sucks. I understand what happens when your jaw wants to hit the floor. I remember when I saw my MRI too, I freaked the hell out, but here I am standing, I'm doing better. I'm 37 now, it's 10 years later. I'm damn glad I didn't have that surgery because I've had so many people that have had surgery that wish they never did, and they're a lot worse from where they are. Number two, get linked up with a 𝐶 method provider. They are the best in the world at finding and fixing the root cause of what's going on, which is scar tissue in these muscles in the neck and all the surrounding tissues. They can get in there very precise and very focused and break that scar tissue down and get that disc in a healing environment. And lastly, if you got any specific questions you want me to cover, send them in. I am always here to help, and I appreciate you guys, and I'll see you on the next one. Bye.